Welcome to the We Talk Health podcast. I'm your host, Kara Mobley, and on today's episode, we are talking about Donate Life Month for April. And today, my guests are James Ross, the West Tennessee Healthcare CEO, and Jill Grandas, the Tennessee Donor Services Executive Director. Welcome to the show, guys.
Thank you.
Thank you both so much for joining us. And as I said, April being Donate Life Month, we want to share a little bit about how donations work, West Tennessee Healthcare's involvement with Tennessee Donor Services, and Jill and JR. I understand that you guys were colleagues in the beginning of your careers, and that Jill, you spent some time at Jackson-Madison County General Hospital in your early career. If you want to talk to me a little bit about that.
Well, I'd love to. Jackson-Madison County General Hospital was my first nursing job ever. I joined the staff of the neurointensive care unit and had just some fabulous mentors in that unit. I remember early in my days there, we were renovating the hospital. And so the neuro unit got moved down beside the SICU. So JR was in the SICU, and he was new to his role at the hospital too. So we became fast friends and colleagues, and worked nights for a while together, and just had a great friendship and collegial relationship as nurses and friends as well. So it was great fun.
Let me share the actual part of this. So we were competing rivals. She was in neuro, and they thought they were all the it. And I was in surgical intensive care, and we knew we were the its. But sure enough, she is correct. A great friendship developed, a great working relationship that has carried on into our more advanced careers.
Yeah, it's been such a blessing to be able to continue to connect as colleagues and friends, just because our worlds interconnect in a really important way. Mm-hmm. When I left the hospital, it was to go work for Tennessee Donor Services. Mm-hmm. When I worked in neuro, I ended up taking care of a lot of patients who became organ donors. Mm-hmm. And so that was my first experience. My first exposure to donation was as a critical care nurse at the hospital. So I was so intrigued by that, and I got the opportunity to work for Tennessee Donor Services there in Jackson for a couple of years, and then moved to Nashville, but continued to stay connected to Jackson through the work of the organ donor program.
Great. Yes. And so with Tennessee Donor Services, I kind of wanted to, Jill, have you kind of give us a little bit more information. It is an organ procurement organization. So kind of tell me a little bit about that and how that works.
An organ procurement organization is a designated program by the Centers for Medicare and Medicaid Services, or CMS. We have a specific designated service area in Tennessee, which in Tennessee, it is all the counties of Tennessee, 84 of the 95. So all the counties in Tennessee except those that border the West. So Jackson is a part of our service area. So our responsibility is multifold. We are the first responders when a patient has met the criteria for organ donation, or we are also called in the event of a cardiorespiratory death when the heart has already stopped for tissue donation. But the CMS, the oversight that we are provided by CMS is to respond to those referrals, evaluate patients' eligibility to be organ donors, and talk with families about their opportunity to donate or to carry out the wishes of the person if they have signed their donor card or have first person consent, is what folks in the hospital will hear it referred to.
Right.
So in any event, our team comes in, evaluates, our family care team talks with the families and carries them through that process of understanding what will happen when their loved one becomes a donor. Then we go to the operating room and a team of surgeons come to do the organ recovery right there in the hospital. And then the organs are transported to the patients who are in need, or the surgeon may take it back if he is the surgeon who's recovering the organ specifically. And all of that happens with, I think we've counted up at some point in who touches this process. Probably in excess of 200 people touch this process every time. And that's not only the staff, Tennessee Donor Services, who are responding, who are speaking with the family, who are working, our critical care nurses or organ recovery coordinators who have a background in critical care, which was my first job when I left the hospital, was to do that, working alongside the hospital staff and physicians and the OR staff and the anesthesiologists, not least of all, the administrative people like JR, who make the policies happen, who help us streamline them. We have hospital development staff who come in and educate. So it's, the lab, the everyone. I mean, there are so many people, all the diagnostics that have to be done in the hospital. I mean, the support and help of the hospital teams, multiple teams of people whose contribution to this process make it happen.
Right. It's a very collaborative effort.
It's a big collaborative effort. There are so many complexities to the process in finding the right patient, evaluating, the organ, it's just, it takes a lot. If you think about it from start to finish, it's a wonder any of it ever gets done. But it is through the collaboration and support of JR and the entire staff of Jackson-Madison County and the West Tennessee Healthcare Group. And I've called on JR a lot over the years, and I can run through that list when you're ready to hear it, for what he has helped support in terms of organ donation. In the early days, JR, I know you will remember, JR even did time in recovering eye tissue for cornea transplants back in the day. So, yep. So it's we've contributed in a lot of ways. I just celebrated my 37th year at Tennessee Donor Services. So I've known you for 40 plus years, sir.
Yes, ma'am. Yes, ma'am. We can keep that to ourselves.
That's fantastic. Now, JR, in terms of the relationship West Tennessee Healthcare has with Tennessee Donor Services, what has that relationship been like for you?
Well, I have to admit that the relationship between Jill and I, recognizing the need, but also recognizing the great potential that the community that Jackson-Madison Hospital serves, really, it was a great opportunity to continue to share the ability to have your loved one's wishes followed, but also see the lives or hear the lives that were saved and touched through your loved one. And so that type of passion led to a mission that we would work together to elevate the knowledge, elevate the skill set of our staff. Really it started with our staff, getting them to understand the importance of organ donation and supporting families once they've made that decision.
Right.
I want to make sure that this is known, and that is, there's many times, or particularly in the past, I think it's become much clearer now, there truly is a working relationship between the two organizations, but there is a separation as well. We're here working to save the lives of those patients, and we work very diligently at that. But when we recognize that our success is really minimal in being able to save that loved one, that conversation is handed off to Tennessee Donor Services, who then takes the opportunity. We say that, you're going to be offered some options at this point for your loved one, and Tennessee Donor Services steps in to have that conversation with those patients. So there is truly a separation in the health care provision of what I'll call saving lives. But then there's also that knowledge set that we have clinically that their loved one is not apt to recover, and recognizing that there's other families that could be served, the life of that patient could be recognized, their decision, pro or con, would be respected, and the families following their decisions and so forth triggers that ability for Tennessee Donor Service to make the request, make the ask, and share with them the potentials that are out there for donation.
Right. And I know that's a difficult conversation to have. And I want to give a shout out to Laura Bryan, who's the Tennessee Donor Services Organ Recovery Coordinator, who works in partnership with West Tennessee healthcare staff to make those donations happen every day.
That is true. Wonderful, wonderful hire that we work together. I think Jill stole her, but anyway, we won't get into tit for tat. But a great, great individual to have working in that role that knows our organization,
Absolutely.
knows many of our staff, as well as the donation staff, organ retrieval staff. And so a great opportunity and a great success story for both our organizations.
Absolutely. What JR isn't telling you is that when we need in our partnership, and we need people from Jackson that, live and work among Jackson-Madison County staff. I mean, it works well when you have somebody like Laura to be able to participate inside the hospital and live among you as one of you to educate, to fulfill that role and help. It's just an extension of the hospital, kind of, but serving patients for the Tennessee Donor Services mission, and really a shared mission. Just, as JR has pointed out beautifully about what it is that we can accomplish together, it becomes a mutual mission to make sure. I mean, not only is it a responsibility of CMS for our organization to respond to referrals, evaluate patients, identify recipients, and carry out those portions of the process. The hospital has a huge responsibility in the process to preserve the option of donation for the family, so that a donor coordinator can get in front of them to talk to them about what their options are, and to do it in a timely enough way for us to be able to not lose that opportunity.
Right,
timing is of the essence. So making the referral in a timely way, supporting the option by making sure we're, keeping the patient in a state that will still afford the option of donation to occur. So the hospital has some huge responsibilities to those requirements, as does Tennessee Donor Services, and working together, as you can see by having 26 organ donors in Jackson last year, seeing the authorization rates rise and the number of donations rise. Jackson General and James Ross, in particular, has done an outstanding work in the community, bringing us into community work, or if we're doing something in the community, Byron Elam is our community services representative for the Jackson area, partnering in community work to promote donation. We did a piece last year, and it was last minute, spur of the moment. We didn't have a plan for this. We had the opportunity to host 6 Meharry Medical College students who are going to be doctors someday.
Wow.
And we had an Associated Press reporter coming to shadow these students for 3 days, for 3 or 4 days, a long weekend in Nashville. And she was going to follow those students everywhere, in the hospital, on referrals, to community events, to the work they were going to do to shadow the experience of organ donation. There aren't enough Black transplant physicians out there. There aren't enough Black nephrologists out there. We are shooting for closing that gap, narrowing that disparity, creating opportunities for exposure for these students to learn about organ donation and transplantation and to seek careers there.
Right.
And that reporter hadn't even landed yet before we had a donation experience come up in Jackson.
Oh, wow.
And that was the first experience for the students to come to Jackson to observe that operating room the procedures in the operating room for organ recovery, and to have JR, when I called him frantically saying, "Oh my goodness, let me tell you what's going on. Please let this reporter come into the hospital," and whatever it takes. And I think that's the attitude that JR and I have shared, whether it has been donation opportunities, obstacles that have been presented on the hospital side or the donor program side. We'll come to each other and say, "We got to fix this." And it's been whatever it takes, Jill. That's the kind of support I have been met with. When we were having issues with, we have extremely supportive funeral directors when it comes to organ and tissue donation now, because JR initiated something between, a relationship between the funeral directors group and the donor program. Probably, I don't know, somewhere between 15 and 20 years ago, but I'm not going to count. So that has been, legislative things that support donation. I mean, I've just always been able to count on him because of his THA involvement, getting ready to count on him some more. So the success is in the relationships from the top down. I mean, that's part of what Laura's job is all about too, is to create relationships and trust among the staff of the hospital. When Tennessee Donor Services walks through the door, they know what to expect. If they don't know what to expect, they'll get the answers when they ask the questions.
Right.
Or we're going to help bring some understanding. There are changes on the horizon to help improve process and outcomes for patients who are needing a transplant that we can help influence. So those are things that I think the relationships and the trust that has been created over the years. And when an obstacle does happen or a barrier pops up, we're there to knock it down and to make it right.
Right.
One key thing that she hit on, and talking about the Meharry students and the lack or the deficit, if you will, of minority physicians being in roles of nephrology and cardiothoracics and other transplant capabilities. It truly is a deficit. And so being able to expose minority students to additional areas that they can practice and make a difference in a multitude of lives. I remember Jill shared some data about the number of minorities that were on kidney transplant lists, or the number of minorities that were receiving dialysis, but yet the lack of minority donors to meet that need. And there still is a huge disparity even today, even though there's been improvement, incremental, as well as because of education and outpouring of community education that people like Mr. Elam has done. We have made strides, but there is still this huge gap, particularly with kidneys and dialysis, minorities being on dialysis, helping our community. And Jill, I haven't shared this with you, but there's a couple of fraternities here locally that I've been talking to, and they've stepped up to help us in some other areas. I want to talk to them about, helping with organ donation, particularly in the minority community, and sharing that story. And, there was back 25, 30 years ago, this huge, 30, whatever you said, Jill, 40 years ago, this huge stigma, particularly in minority community, African-American community, about, I'm not going to let them do anything to my body, and after I'm deceased. And, whenever you start having your mother, your sister, your loved one that is having to go on dialysis, it opens your eyes, but there was still this hesitancy, this reticence about organ donation. And if there's any one thing that I'm really, really proud of is that stigma, if you will, that curtain has begun to move down, and we're seeing more donations in that area, but we still have a long way to go. For all of donation, I'll tell you, there were times in the early 80s, middle 80s, late 80s, where Jackson-Madison only did like 7 donations a year. And so this latest data of just from January of 23 till February of 24, having 33 organ donors. I mean, that is a multiple
Fantastic.
Exciting, and you really want to get behind. And I've seen that with our staff helping pull the curtain down, talking more amongst themselves, talking about signing their driver's license to be an organ donor,
Right.
paying the extra $1 or whatever it is whenever they renew their tags, coming out whenever we have a flag raising ceremony during the month of April about organ donation. Jill, I still remember it was a big deal for us to, when we started putting the organ donation flag up.
Yeah.
Besides the state flag and besides the American flag, we took down our hospital flag, and then we were putting up, and there was a lot of folks, I don't know. Well, we now celebrate that, leave the flag up all month, and even have special ceremonies. Families who have consented to donation will come, and we'll spend some time around the flagpole and just share and pray for the families. And it's really become much more of an integral part of whole healthcare, of the whole healthcare realm.
Right. And it's, in addition to providing educational opportunities, it is about honoring the donors and their families, and, promoting donation. And you mentioned that from January of last year to February of this year, there were 33 organ donors, and that amounts to about 74 lives saved. So one donation can save multiple lives. And Jill, I wanted to ask you to kind of talk about the connection between race and organ matching.
Sure. JR alluded to this, and, we talked a little bit about the Meharry program, and we're getting ready to do it again, by the way.
Okay.
6 more students are going to join us for June and July of this year. We just did a webinar for the Association of Organ Procurement Organizations to share with Dr. Hildreth and myself the template for how other programs can do the same thing in their community with an HBCU or in a medical school that might not be an HBCU, because many medical schools have a Black Student Association. So, it doesn't have to be limited to that. But with regard to matching, the reason that we really want to encourage from a registry standpoint for more African Americans to register themselves is because when a Black kidney becomes available from a Black patient, it matches better because of the antigen matches better with a Black patient waiting. So that really, the more we can encourage people to donate, the higher likelihood that we're serving the Black community. And also, I think from, one of the goals about having more African American physicians, even if these students that we're working with don't go into nephrology or become a transplant surgeon, I know from the 6 students that presented last year on their research projects, they all left that project being an advocate for organ donation. So those students, when they go back to their communities to become physicians or whatever hospital, whatever career path they choose, they will be able to advocate that this process is important. It's important that African Americans donate, that we learned about the system. We learned about how people whose lives are changed. We know how the donor program carries out this process. We know how the hospital takes care of these patients. So I think the trust factor is supported by the experience that they had, the trust in the trust that the hospital is taking care of the patient, the trust that the families are being cared for through that entire process. But from a matching standpoint, donating is important because of the degree of match that will be improved.
And, in collaboration with Tennessee Donor Services and West Tennessee Healthcare, having this record-breaking year is very encouraging, and getting the number of donors, of lives being saved by donors up through Jackson-Madison County General Hospital. It's great to see the education getting out there, and also, participating in honoring those who,
yes,
because it is
yes.
such, it is a very close, tender, subject.
Yes, it is. Yeah.
Speaking to that, I want to also share that there's this concern. Well, can I have an open casket after doing an organ donation? Yes. Can I still stay with my loved one until you take them to? Yes. How will I be notified about the success of donation as far as it goes to saving other lives being transplanted? Yes, there's methodology, and we'll stay very close to you, and the hospital stays close to those patients' families, because it has been a very trying time, not only on the family, but also on the staff, because with these cases, they get very, very involved. It is an area of care that is truly separated from the acute care. There's a whole new chart that started and all of that to help take care of the donor until they go to surgery. And so all of those things really, really are the sensitivity that both organizations work to make sure families are knowledgeable about that. And then this whole new collaborative of working with the funeral homes to make sure that they understand why certain things, certain procedures, certain, if you will, procedures are done after the retrieval is done, and bringing them along in that understanding has been a huge positive thing, because they were kind of the missing piece. They were dealing with, if you will, the end of the end, but they didn't understand the full depth and breadth of why we do certain things and why TDS does certain things. And, there's a period of time of talking to the family, allowing them time to make decisions. And yes, theoretically, brain death or cardiac death has happened, but that doesn't mean that the funeral home is ready to come, and TDS and all of those folks will be here, within 2 hours, and we can release it. There is a huge process that works in the background. And so getting the funeral home directors caught up to speed, Jill has had great success in working with them. And so it is really coming full circle, this collaborative nature. But overall of that, it is the family that has made the decision, respecting their wishes before and after donation, and then the number of lives that have been saved, and recognizing, here's a life that is able to go on. It really does, whenever you're a caregiver, being able to see that process all the way through, it helps you get up and come back the next day and be able to take care of what potentially is another donor, or a family that is dealing with a loved one that is not going to survive. And, we still believe in miracles, and God is in control, and we're a spiritual organization. Majority of our patients are spiritually led. And so we provide that support as well. But as my mother used to say, when you're sick and you can't get well, there's a better place. And so we support that through our pastoral care and so forth, if the families so choose to accept that. And it really is full circle, full care once the decision is made.
Right. But I want to go ahead and share that there are approximately 3,000 Tennesseans waiting on life-saving gift of donation. And I want to go ahead and let people know that at Jackson-Madison County General Hospital this month on April 18th at 2 p.m., we will be having the Donate Life ceremony to honor those who gave the gift of life. And then we also want to let people know that if you want to register to donate, obviously you can do that on your driver's license, or you can visit bethegifttoday.com. Well, great. Do you guys have anything else for me or that you want to add? This is definitely good to get this message out to continue.
We appreciate it so much. Thank you. It's my absolute pleasure and honor to be with you, my friend, and look forward to continued opportunities to work together.
You too. And I can't believe you brought up how long we've known each other, but anyway, I'll let that slide.
Well, thank you guys so much. This has been,
Thanks so
been
much.
very educational. We're glad to get this message out to everyone. You guys.
Bye.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.